All right, the centre has sent an advisory to all social media platforms not to allow the term Indian variant to be used. The centre's advisory cites terminology fixed by the World Health Organization to name variants. Earlier, Singapore too had followed such measures. Rahul Srivastava is getting us more details on that story right from the beginning of the pandemic and even in the past, Rahul. And this has always been the norm with the World Health Organization that you can't call it Mexican flu. It has to be H1N1. You can't call it the Wuhan virus. It has to be SARS-CoV-2. And the same applies to all variants also.
Yes, Neha, you're absolutely right. And if you look at it, that some people have been colloquially using it for a certain degree of convenience. But in the last, I think, 15 days, it has gained traction largely as a motive to create a political inference that it is an Indian variant. And that's where lies the worry for the government, that this terminology Indian variant does create a certain amount of reference to India as far as the pandemic, global pandemic is concerned. Because remember that the second surge has been ferocious in India and the focus is largely being talked about as India. And that's why the government has written to all social media platforms and asked them to remove with immediate effect all content that refers to or insinuates that the B.1.617 strain of coronavirus is an Indian variant. So they are saying that the government has issued it as an advisory. It is not an order or a diktat. The government has said that it has come to our knowledge that a false statement is being circulated online, which implies that an Indian variant of coronavirus is spreading across the countries. This is completely false, and that's why the government has requested that all content with Indian variant as a terminology being used should be removed, and this falsehood should be eradicated.
Yes, not just for this particular variant, for B1.617, all variants have to be named in a way that is in sync with what the WHO has said, instead of naming them, linking them with the country from where they're believed to have originated, is what the WHO has also said. Rahul, thank you for getting us up to speed with those developments.